Oftentimes patients ask me, when should I use heat and when should I use ice? What I encourage people to do is to use ice when you have pain present, and if you have more stiffness or soreness, go ahead and use heat. What I like people to realize is that if I use heat at the wrong time, I could actually aggravate my symptoms. It may feel good at the time, but you wait 3 to 4 hours and you'll have more pain, particularly in the presence of inflammation. Heat is at its best when it's followed by some stretching and some mobility afterwards. Putting heat underneath an area, for example, laying on a heating pad, is a bad idea. You trap the heat and you can end up with a burn from the heat. Also, cold packs or ice, it's important to be aware of the skin. If it starts to become numb, if the skin starts to raise a little bit, begins to look white, it's time to remove that ice because you want to avoid frostbite. I have a cold pack here that we happen to use in our clinic, and a lot of times what I do is I'll fold a towel around it. I typically use a hand-sized towel. I'll have 2 layers on one on the other, and then if I wanted it on my shoulder, I could put one end back behind me and then the other hand in front of me. I oftentimes use it for about 30 minutes, and a lot of times that will really settle down. I have with me an ice cup that we use here in our clinic. Here what we've done is I've put ice cubes in it, filled it full of water. The reason I put the ice cubes in ahead of time, it keeps the cup from expanding too much and tearing. The styrofoam in this is really nice because it keeps your hand from freezing. And if I can catch a corner of a fingernail, I can use a pen. If I have a dull knife or something, I could use that too. But I've made a line all the way around this cup. At this point, I'm going to tear it off. And now you see the ice cup ready to go. At this point, if I'm going to use it on an area, in this case I'm going to do it on my forearm. This will drip a lot. You'll go through stinging, aching, burning. Oftentimes after about 5 to 7 minutes, the cold from this doesn't seem quite so severe. At that point I can go ahead and remove it, and this method oftentimes works better when we have a lot of pain present. A lot of times it brings the pain down, sometimes up to 4 hours. Thank you for watching this video. I trust you found this video useful. We'd like you to better enjoy life, and don't forget to subscribe to our YouTube channel.